Welcome to PSL Living. I'm Sarah Prohaska, Public Information Officer with the City of Port St. Lucie. Our first guest today is Sydney Liebman of HANDS, a Volunteers in Medicine clinic in St. Lucie County. It's a clinic that provides free health care to uninsured and low-income residents throughout the county and also here in Port St. Lucie. Thank you so much for joining us, Sydney. We really appreciate you coming on.
Thank you for having me.
So let's just start off, let the public know a little bit about what your clinic does.
Absolutely. HANDS is a Volunteers in Medicine affiliate and has been since we started in 2010. So the clinic has been open for a little over 6 years now, and we provide free health care to low-income, uninsured adult residents of St. Lucie County. They need to be in the county for a legal resident for at least 6 months. They need to have income qualifications up to 200% of the current poverty level, but that poverty level depends upon how many people are in the household. Okay. So that can change depending on whether or not there are children.
Okay. And if they just walk in, or do they have to make an appointment, or how does that work?
They do need to make an appointment. We have patient navigators that assist them through the qualification process. And so those folks, those 3 patient navigators that we have on staff, they go through the income requirements with them, tax return requirements, any pay stubs. The majority of our patients are employed.
Okay.
There's a little bit of a misnomer that they're unemployed, and very few are unemployed.
Okay, yeah, but they just don't have the insurance, so they really need this. How big is your clientele in Port St. Lucie? Do you know off the top of your head how many people in Port St. Lucie you serve?
I can do it kind of an opposite way.
Okay.
Less than 20% of our patients reside in Fort Pierce.
Okay.
Less than 20% reside in St. Lucie County, those areas that are not Fort Pierce or Port St. Lucie. And the rest are from Port St. Lucie. Okay. Now, I know how confusing that sounds, but the number of our population from Port St. Lucie, our patient population from Port St. Lucie, is also a little confusing at times because we track those areas, Tradition, St. Lucie West, and even though those are Port St. Lucie, we separate them out.
Okay.
Did that make sense?
Yeah. But what I'm trying to get at is your clinic is physically in Fort Pierce, correct? But I don't want people to think that just because it's in Fort Pierce that it's not for Port St. Lucie residents.
Exactly.
Yes.
The majority of our patients come from Port St. Lucie, for sure. The clinic is located, for anyone who has lived here any length of time, it's located in the old Sam's Club building, which is on US 1, about a mile north of Midway Road. Okay. And we are inside that building because it's owned by the county, and they have graciously given us space in that building at no cost.
Okay, great. And I know that you rely really on grants. Your funding relies on grants and volunteers and private donations. How all of your doctors, they're all volunteers, correct?
All of our physicians, all of our dentists, those are all volunteers. Okay. We have 15 people on staff in the clinic. Most of them are part-time. A few are full-time. And you do, in a medical facility like that, you do need some staff because of federal guidelines that we have to follow and reporting guidelines for our grants. And so we do need some folks that are readily available and there. Available, right? Yes.
So if a doctor is watching this, or a nurse, right, or any kind of medical professional who wants to be involved, how would they get in touch with you? How would they get involved?
We desperately need physicians to come in and volunteer for sure. And the best way to do that is either to give us a call, and our number is 772-462-5646, or they can go online to our website, which currently is handsofslc.org, and there's information about volunteering there. One of the perks to volunteering at a Volunteers in Medicine clinic like HANDS is the fact that no physician can be sued. They are covered under what's called sovereign immunity because they are volunteers.
That's very interesting. Okay, so they can not have to worry about that and give of their time and their talents and their knowledge without having to worry about that. That's good.
And we've learned recently some of the physicians in the area are not aware of that.
Okay.
And so that has held them back from volunteering at the clinic. So we try to lead with that now whenever we're asking for volunteers.
Yeah,
so
that's good information for them to know, I'm sure, and making their decision. Now, you do private fundraising also, and you were telling me about a necklace, the Julia Project. Can you tell me a little bit about that?
I'd love to. I happen to be wearing Julia today, so I'm excited. The Julia Project comes from right out of the pages of a book called The Necklace. And in the necklace, the women, it was a true story of a group of women in California, and they pooled their funds to buy a $40,000 diamond necklace and share it.
Okay.
What we've done is taken it one step farther, well, maybe two steps. We got the necklace donated, first of all, from G. Allen Fine Jewelers in Fort Pierce. And then in addition, 12 women are sharing the necklace. During the month that they own the necklace, they put on a fundraiser. They host a fundraiser. They bring awareness to the clinic by going out and speaking at civic organizations or having me come out and speak. And in the 18 months that the project has been going on, they have raised $280,000.
Wow. That is great. So, but you were telling me, even all this money that's raised, you still don't have reserves, right? It's pretty much spent as soon as you get it, because you're a zero. I'm sorry, zero base. Or
yes, I'm sorry. We started out being funded by what's called a low-income pool.
Okay.
And that was a federal line item that eventually became tied to expanding Medicaid. And the state of Florida did not expand Medicaid, and so the low-income pool fund disappeared. And so we were left with nothing. Yes, a huge, that was a $700,000 hit. And so we were left basically as if we had renewed. It was like a rebirth. And we started with nothing, and unfortunately we still have nothing, but we're keeping the clinic open. So the clinic has continued to serve our patients. In the 2 years since we lost the low-income pool, we've raised enough money on a weekly, monthly basis to keep it open, and we've had an approximate 19,000 patient visits during those 2 years. So, you know, there's been some talk by some folks, well, I feel like I might be throwing good money into bad if I donate. And the bottom line is, whether we stay open one more day, one more week, one more month, one more year, those are still folks that are going to be seen by our physicians that otherwise would not be seen by anyone. And I believe that we're going to be able to keep this clinic open. It's just a matter of getting the community involved and understanding the need of this clinic. 72,000 people are uninsured in this county. That's 1/3 of our adult population. And it's unfortunate that so many businesses here don't offer benefits, but it's the way it's the way of the world today. And so keeping the clinic open is just extremely vital to this community.
Important. So anyone who may be interested in fundraising for you, donating money, donating their time, please call that number that we'll have it on the screen. But
absolutely.
And then another thing I wanted to touch on, which I found really interesting, is your clinic is mainly primary care, but you have patient navigators who work with, like you said, like if they have a diagnosis that requires more, you don't just say, okay, bye. You work with them still. How does that work?
It's really a wonderful, wonderful thing that we have 65 collaborative partnerships with outside healthcare providers. For example, Moffitt Cancer Center over in the Tampa area, all of the hospitals here in St. Lucie County, including Martin Health System and the 2 HCA hospitals. We have partnerships with them. We have partnerships with at least 60 other outside providers, so that if someone is diagnosed with a chronic disease that needs continued treatment, we are able so far
Yeah,
to find treatment for them at no cost.
Okay.
Now, there are times that we are billed. And so about a third of our budget goes towards those times that we have to pay for that patient's care, which we will do.
Which you do, which is, that's amazing. So
it's not an everyday occurrence, thank goodness, but it does happen. So about a third of our budget is salaries. About a third of our budget is medical care, and about the other third is supplies and things that we need within the office.
Okay, great. All right, and then once again, you only handle adult patients.
Adults.
But you also have a pediatric dentistry program that you were telling me about. That sounds really great. That you do the school-based sealants. So tell us a little bit about how that works.
Our pediatric dental program, we're just so proud of it. We're so thrilled. And it's fully funded, and that's a wonderful thing,
great.
too.
Yeah, so you don't have to worry about that one.
Exactly right. It's a wonderful, wonderful program. Irvin Valson is our hygienist, and he goes out into the schools. And during the summer, he goes to the Boys and Girls Clubs and to the early learning centers, and he provides dental checks on more than 10,000 children every school year. In fact, he's adding schools this year, and so he thinks his number will be close to 13,000 by the end of this school year.
Okay, that's great. Preventative care for those kids. If they don't have to get a cavity, that's
exactly
good.
right. Because statistics show that nationwide, 51 million hours of school time is lost due to dental pain and dental illnesses.
Can't concentrate. I mean, it really does disrupt everything because it's if you have a problem in your mouth, that's something you're always having to deal with. So.
And there's a large percentage of children that he sees for the first time that have never even heard the word toothbrush uttered in their home.
Oh my goodness.
So they don't even own one. So, or they own one and the whole family shares it.
Geez.
So this program has been just a godsend. And he provides them with toothbrushes and toothpaste and floss and instructions on dental hygiene. And some of the early learning centers, it's cute, they keep their toothbrushes at the school. And so when they come into school, they all brush their teeth together. And then after lunch, they brush them together.
Oh, that's great.
And then they pack them away.
Yeah, get that habit going when they're little. That's the way to start it. And if he finds a case that needs extra help, you guys work with local dentists who could follow up with them, right?
Yes, he does that. Irvin does that. He'll call different dentists in the area, sometimes out of our area, until he can find someone that will see those children.
Oh, that's wonderful. Okay. All right, Sydney, is there anything else you want to touch on that I have not brought up here today?
No, I just hope that everyone out there hears how important it is to keep this clinic open. As we draw new businesses into this community, and we all love it here, we all call it paradise. I hear it everywhere I go. So as we draw new businesses in, we need a pool of people that will work in those new businesses. And those 72,000 uninsured folks are who they're going to pull from. And so let's get everyone healthy, and let's support this clinic.
Keep them healthy. All right, Sydney, thank you so much for coming on. It's very important information.
Thank you.
All right. And we'll be right back after these messages.